Hey mamas, and welcome to the Entering Motherhood podcast. I'm your host, Sarah Marie Bilger, a wife, mom of two, VBAC mama, and doula. Here we integrate holistic mindfulness and evidence-based practices to support you on your unique motherhood journey. Whether you're trying to conceive, pregnant, newly postpartum, or supporting mamas in this stage of life, you'll feel empowered and informed as you embrace what lies ahead. Join us every episode to learn from professionals, special guests, and moms just like you, ensuring that you know what you need to know and discover things that you didn't know before. I believe in you. Let's doula this and let's navigate the transition of entering motherhood together. Hey mamas, and welcome back to another episode of the Entering Motherhood podcast. I'm Sarah Marie, and today we're diving deep into labor inductions. In this episode, we're going to cover both medical and non-medical induction methods, plus I'll give you some key tips for avoiding unnecessary inductions. So in more recent episodes, we have discussed ways that you can manage your blood pressure during pregnancy, and this is one reason that I have seen most commonly and more recently as to why some people may be recommended for them to be induced before they have reached full term or that 40-week mark. So if you are in that situation, consider going back and listening to that episode about high blood pressure or blood pressure reasons in general. But for now, let's start by taking you through just a few popular options of non-medical ways to try and get labor going naturally. I do want to point out, though, that some of these methods may be effective and useful, but overall, your body will respond when it's ready and when baby's ready. So there may be some situations such as lung development or positioning that is the reason that labor has not started yet. So just try to be patient. I know that's easier said than done. So try to do that if at all possible. But I know when we reach those last few weeks that it just can be a lot more difficult to wait, and we might be getting uncomfortable, and we're just ready for the next stage. We're ready for our baby, and we're ready for pregnancy to just kind of be done. So first up, I want to talk about nipple stimulation. If you are stimulating your nipples, this has the ability to release oxytocin, which can trigger contractions. You can do this with your hands or you can use a breast pump, but really just try to start slow and maybe try only stimulating one nipple at a time to really help avoid overstimulation and bringing on strong contractions, because it does have the ability to do that with some mamas. The pros of this is really going to be it's natural, it's for the most part hopefully painless, and it can be done right at home. But on the downside, sometimes, like I said, these contractions can get a bit strong and kind of like hard to handle because it is coming on quite quickly. The next method, which is probably the most commonly suggested method that you might hear, is going to be to have sex. Specifically, the semen and orgasms is what's going to increase prostaglandin levels and oxytocin levels, and this is what's going to be triggering labor. It's, again, another natural option. But keep in mind that if your water has already broken, sex could really raise the risk of infection because you're introducing something into the vaginal area, and this could lead to not so ideal side effects. So if your water has broken, maybe not this method. And then another method is to use castor oil. This is probably the most controversial method out there because there is a lot of different stories that have been told and not a lot of research surrounding it. And I would highly suggest that you dig around and do your own research and talk to your provider and really kind of consider this one a little bit more strongly before you try it if this is something that you're considering. But ideally, the idea here is that stimulating your digestive tract can also help start to stimulate labor contractions. But the reason that this is so controversial is because the castor oil often causes vomiting and diarrhea and not so pleasant effects that are happening, and really can just be altering your experience in ways that you might not actually want. And some say that spicy foods can have a similar effect without as many unpleasant side effects. But again, it's definitely something to just be cautious about and really do your own research and look into if this is something that you want to try. And then another option that's a non-medical option of induction methods would be acupuncture or acupressure. And this is done by stimulating certain points of the body with either a needle or simply by applying pressure to those parts. And some people believe that this can really start to bring on labor and get things going. There is one that I used during my first pregnancy that I really feel was sending all of the signals to my baby and getting things going maybe a little bit earlier than I had wanted to. So definitely remember that if you are doing these methods, if you are starting to introduce these in your pregnancy, that you are past a point of your pregnancy that it is safe to be doing these methods, and you're truly really ready for things to get going if that is what you are trying to accomplish. So, again, with the acupuncture and acupressure, the good news with this is if it's not working or is causing any kind of discomfort, you can just stop it. Like, obviously, just don't go and get another treatment or continue to push on those places. But, overall research hasn't shown any harmful side effects from this. So it could be worth a try, and it could just be something to pass the time and get things going. And then lastly, there are some herbal supplements that you can take. Typically, these are taken as a tea. They're usually inexpensive and very easily, obviously, to do at home. And again, just with this, there's very little research on this because it's not something that people are necessarily interested in fully getting research done on. So their safety and effectiveness is, again, like one of those things that is a little controversial and questioned. So you just want to be aware of this and understand why there might be some hesitation from others when it comes to herbal supplements, and really just understand that this is your birth and your body and your choice. And if you feel like it's something that's going to be beneficial for you, then I say go ahead and go try it and check it out, because if anything, it's just going to help progress labor to get started, and maybe you avoid any medical induction methods or any unnecessary interventions later on down the line. So with that, let's kind of switch gears and talk more about medical inductions and methods that are more medically done. So one common method is stripping, or what they call sweeping of the membranes. And this is something that your provider is going to do usually during a cervical exam. And they're generally just gently lifting the amniotic sac off of the cervix and separating those two slightly. And this sometimes can completely jumpstart your labor and get things going. But with everything, there are benefits and risks, and the risk that can be associated with sweeping of membranes is infection and possible rupture because you're disturbing the cervical area and the amniotic sac. So just keeping that in mind and knowing what your risks and benefits are, but also knowing that maybe this is something that you want to consider and something that's completely safe and you want to do, because it's one of the least invasive ways that we can be medically inducing labor. So typically, if you are going for a scheduled induction, this is going to start out by them needing to ripen your cervix. They want to get your cervix more elastic and softened. So typically, a popular option for this is going to be Cervidil, and it's a gel-like substance that's placed in the cervix. And the good news with this option is it can be removed if you're having any issues that arise, or if you're having, a not great reaction to it. It can be removed and those side effects can quickly stop. But the issues that typically come with Cervidil is there are very strong, uncomfortable contractions. Sometimes there can be swelling, and even some painful feelings in your chest can occur. So this is what I mean by, like, if any of these side effects are occurring, they can quickly remove it and really deal and move on and choose another plan moving forward if you are having these kinds of reactions with the Cervidil. And then if that's the route that it's going and that's what you're using and that is helping to soften your cervix, and that's great. Another medication that they might use is misoprostol, or what they call Cytotec. And this is another option. It's a tiny little pill that you just get, and usually it's ingested in your mouth. And the thing with this, though, unlike Cervidil, is it can't be removed once it's inserted, and it's just going to run its course and do its thing, and is quickly in your system and ingest it into your body, and is going to do what it does. And typically this comes sometimes with a higher risk of uterine hyperstimulation or fetal distress. So they're going to be looking out for those things. You are taking this 100% in the hospital and under supervision. So if something is happening, if something is occurring, they're going to be able to see this immediately and handle it and be able to address it. But, most options will have this as an option because it's cheaper, it's a lot more accessible, and it does tend to result in a shorter length of labor and a more successful outcome than other methods of induction. So you'll typically be given one dose about every 4 hours. And once your contractions have really began to pick up and they're coming in consistently and strongly, you have most likely reached about 4 centimeters. And at that point, they will no longer use this method of induction. And you very well might not need any other further interventions. And this could be what does it to really kickstart your labor and get you going and progressing consistently and never need any other interventions before baby comes. But if they have introduced Cytotec or Cervidil and maybe your cervix is softening, but it's not dilating, another medical induction intervention that they utilize is something called a Foley bulb. And this is a small device that is inserted in the cervix to help manually dilate it. You can Google Foley bulb, you can see what it looks like. But essentially it is just very similar to a catheter that goes up into the cervix, and the Foley bulb will, like I said, usually be introduced after a few doses of Cytotec, and it has the ability to help you dilate to about that 3 or 4 centimeter mark. And after you get to about 4 centimeters, it will just fall out because the size of the bulb is about that 4 centimeters. So once you are dilated there, it just kind of drops out, or you will feel it release after this point. And so this is a non-medicated option, but it is still a medical induction method. And many women tend to find it quite painful, or at the very least uncomfortable. But like I said, we're not in this case introducing any medication, and so it usually can be a preferred method if you are looking to be unmedicated for your birthing experience. And of course, because it's something that's being introduced into the cervix, it does have the ability to increase your risk of infection. And it's not always a guarantee that it's going to start labor. So usually you are getting kind of a mix of different kind of techniques going on along with the Foley Bob. So, you might have that and some sort of medication to get labor going. So another non-medicated medical method could be rupturing your membranes. So this can be done during a vaginal exam with a small plastic hook-like tool. And it's typically done after you're already a few centimeters dilated. Obviously, you have to be somewhat dilated for them to be able to utilize the hook and break your waters. And this might kickstart labor. It might intensify your contractions. Of course, it has the ability to increase your risk of abnormal fetal heart tones and infection. And, with most providers, though, they are typically suggesting this later on in your labor to just keep things more consistently, but it might be something to just be aware of and understand that some providers might put you on a clock. So you will, once your water has broken. So there might be some policy or some kind of known indication of after your water breaks that they will sort of suggest or feel that, your baby needs to come after a certain amount of time after your water has broken because it could lead to infection. So if you're showing other signs of infection and your water has been broken for, let's say, 24 hours, this could lead to a provider suggesting to have a cesarean. So keep that in mind if you are considering having your water broken versus letting it break or rupture on its own. And definitely discuss this with your provider beforehand to be aware of your options and any expectations that they might have after your membranes have been ruptured and what that might mean for your birth plan moving forward. And then, of course, we have Pitocin. This is probably one of the most commonly known forms of medication that is utilized to kickstart or increase contractions and induce labor. This is one of the more commonly used drugs in a hospital setting, and it's delivered through an IV, and the dosage can be adjusted as needed. And Pitocin-induced contractions are often quite strong and can be painful, and again increases that risk of fetal distress or also postpartum blood loss and jaundice in newborns. But for the most part, it's going to be something that is very routine and very commonly practiced in a hospital setting as far as inductions are done. And you typically want to wait about 30 minutes to an hour before increasing the dosage of Pitocin, because this is how long it takes for your body to really adjust and regulate at that next level. So your provider will most likely start you at about 2 milliunits per minute and then increase it by 2 milliunits until it caps out at about 16 or 18 milliunits per minute. And I honestly feel like anything over 10 is just starting out like way too strong. And if you're having steady and consistent contractions, you should be able to turn it off or reduce your Pitocin levels to allow your baby to naturally continue to progress and your labor to continue on its own without the Pitocin. So like I said, that starting at 2 milliunits, going up 2 milliunits every half an hour or an hour, you're really looking at about 4 hours of Pitocin being introduced before we're getting to that 10 milliunits per minute. And so at that point, it really should be doing what it needs to be doing, and your body should start to react. If not, then maybe, everybody is different and increasing that up. But if they're, pushing more than 2 milliunits per hour, definitely kind of just question that and ask, why are we introducing this so quickly? And is there a way that we can do this slowly? So with that all being said, you may be wondering, okay, but how can I, avoid any unnecessary inductions? What if I don't want Pitocin or Cytotec or the Foley bulb? And they're saying, hey, we got to induce because baby's got to get out and we got to get things going. So there are 5 really important things for you to consider to help avoid any unnecessary inductions. And the first I will say is try to avoid any sort of routine fetal testing unless there's a specific indication that you need to be testing. There is no evidence showing that better outcomes come based on routine testing for any sort of overdue pregnancies. And so really just kind of keeping any sort of intervention before labor starts to a minimum and lowering the testing or ultrasounds that might come before labor has started. Another thing that you can do is calculate your due date on your own and calculate it based on conception and your menstrual cycle. If this is something that, you had been tracking, you have been doing yourself, and you feel pretty confident in, go based on that, not just based on the ultrasound estimates, because this could be off compared to what they're saying is the size of your baby, and maybe they're estimating that you're due a lot sooner than you actually had predicted. So making sure that you're kind of tracking those things and you're aware of when conception actually occurred versus just relying on the ultrasound estimations. Another thing, number 3, would be don't let your due date be changed based on the anatomy scan. So again, looking at that early ultrasound estimation, and they're putting a due date on, if you are having a 20-week anatomy scan and they're saying that baby is measuring at a certain different point and now they're changing the due date again, really kind of pushing that or question that, because if they're saying that you're supposed to be due a lot sooner than you actually are, then you might only be 40 weeks along and they believe that you're 42 weeks, which could make a huge difference as far as policy and protocol and what they are doing for you at that time. So really kind of push and question if they are changing your due date based on an anatomy scan that's taking place after you're already 12 weeks. With that, then number 4 would be to not agree to have an induction based on the suspicion of a large baby. There is a lot that can happen with this. There is a lot of stories with this where they had a growth scan and baby was measuring big, and then baby comes out and baby is not as big as they had estimated. So really just understanding and knowing, how you feel and what you feel comfortable with. There is evidence-based research on big babies that you can look up and you can educate yourself on. And I'll probably end up doing an episode on this just itself, because there is so much here with this conversation and so much to be said about big babies and the possibility of a big baby and how your body can't birth big babies, which is not true. And there are very few circumstances that you are not able to birth your baby based on their size. There might be different risks associated or different situations that can occur, but having or suspecting a large baby is not enough of a reason to induce, in my opinion. And then number 5, most importantly, make sure that you choose a care provider who respects you and ultimately knows that you have the authority in your birth plan. So look for someone with low induction rates and who won't push for an induction before 42 weeks unless it's really, truly medically necessary. So, ask about their induction rate. Ask what might lead to needing an induction, and be aware of how your care provider really handles these different situations. And then if you do end up needing an induction for something medically necessary, there are a few tips for really making it as smooth as possible. For cervical ripening, try to opt for Cervidil since it can be removed if needed. If you have the option, some hospitals, specifically around here, they're only using Cytotec or Pitocin, the Foley bulb, things like that. And Cervidil is not available, but see if that is something that can be used to get things going. Try to start the induction at night because it can help you sleep through your early stages of labor, and oxytocin tends to naturally flow more easily at night. But I will say with this, that's typically going to be a great method, but anything can happen. Birth is completely unpredictable. And I specifically remember one of my clients, I had told them to, rest as much as possible. The husband had actually taken a Benadryl so that he could sleep and get as much sleep as possible. And things just really took off. This was a client that took Cytotec, and it just really responded in her body and really got things going. And labor progressed very quickly. So they did not have time to sleep and rest during early labor because there really wasn't time for it. And it was a very fast and quick progression of labor. So, do what you want to do and go in when you feel ready or when they have availability. And, if it's starting to get late at night and you'd rather just stay at home and sleep and be comfortable and then go in the next morning, see if that's available or that's an option. So really kind of knowing what you want and what you're going to feel most comfortable doing is a great thing to help make it as smooth as possible. And then when using Pitocin, make sure that you're asking your care provider to use a low dose and continue to increase it slowly. Like I talked about, that 2 milliunits every hour. That should be kind of a framework for what you're looking at and how you're progressing and how often that Pitocin is being introduced to your body. So knowing that, being aware of that, and understanding what your options are during this time can really help make the induction process more enjoyable for you and help you feel more informed and in control of your own birthing experience. Another thing that can really help make things smooth is once you're in active labor, try to turn off that Pitocin. See if your body can start to take over and naturally get going and doing what it needs to do. Like I said, they can always bump it back up, but if you're really staying consistent with those contractions, if they're coming on strong, lower it or turn off the Pitocin to see just how your body can react and what it does without it. This is obviously a personal choice, but if you are avoiding the epidural, that is going to help your induction flow more smoothly because epidurals can actually slow down labor and increase the need for even more Pitocin at times and other medical interventions. So like I said, this is obviously a personal choice. If there is no epidural, that means that you're going unmedicated. And so that is something that you need to decide and think about, or just understand if you are taking the epidural, it could slow down labor and just make things progress slower, and you would just have a longer birthing experience. But if you don't want to go unmedicated, then obviously getting the epidural would be the option for you. Another thing would be to not have your water manually broken. Again, like I was saying, if you are already in active labor and everything is progressing smoothly, then there really is no need to break your water manually. I have seen in some situations when mama is already super far dilated, maybe like 8 centimeters, 9 centimeters, if they break the water or if they can tell that it's bulging, then once the water is broken, baby drops down, and it just makes things progress fully to where you're fully dilated and you need to be. So in some situations, sure, breaking your water might be a good alternative and something that can help, but really try to just avoid this if you are in early labor, obviously, and as long as possible while you're in active labor. And finally, limit or refuse the vaginal exams, because this is just going to increase the risk of infection. And if your water is broken, it's going to increase that chance even more. So vaginal exams, while they can be beneficial in some circumstances, really limiting them and making sure that they're not being overly utilized can help just make things smoother as far as inductions go. So I know this is a lot to think about, but most importantly, just focus on trusting yourself and listening to your body. Your body knows what to do. And I know that can be hard to hear sometimes and it can be difficult, but if we're really starting to get in that mindset and trust our body and just know that it knows what to do, even if we feel like, what if it doesn't? Or we have those doubts, just really trying to have a more positive mindset and have that special connection with your baby and talk to your baby and feel your body out and just sort of trust in that intuition that is going on. So as always, head over to the show notes and feel free to reach out to me, either by email or on Instagram if you have any follow-up questions about this episode. But that's it for today's episode. I hope you found this information helpful and, useful as you are preparing for your birthing experience. If you enjoyed today's episode, don't forget to subscribe or leave a review or share it with another mama who might be needing this information as well. We also have our childbirth education course coming up soon. We are really getting things together and getting that finalized, but it's going to cover topics just like this and so much more. And we really hope to have such a strong community surrounding the childbirth course that you can tap into and you can be a part of. So if you want to learn more about that, go again, look at the show notes and look for information on how to join the wait list. Until next time, take care of yourself and keep trusting that amazing body of yours, mama. See you later. Thank you, mamas, so much for listening. Remember, you are a rock star. I believe in you. Let's doula this. Let's crank it up a notch and let's kick it into high gear together. Hit that subscribe button, share this episode with a friend, message me, email me, call me, beat me. You know how to reach me. We're doing this, mamas. I am so excited to catch you here next week. This is your one-stop go-to place for helping you find the resources you need to make the best choices for you and your family during pregnancy, birth, and most importantly, postpartum. See you later, mamas.